Good afternoon, everyone. Thank you for tuning in to our talk on University Health Service and how we here at UHS can support your student during their time at University of Michigan. I'd first like to introduce myself and also my colleague, and then we'll begin our talk. My name is Amy Maslick. I am a family physician and am responsible for running the primary care clinic. Jason, do you want to introduce yourself?
Good afternoon. It's a privilege to have the opportunity to talk with you. My name's Jason Schelhaas. I'm one of the internal medicine and sports medicine doctors at the University Health Service, and I also run our immunization program. And at any point during the talk, you can feel free to ask questions in the question and answer section, and I will be replying to those. And then at the end of the talk, we will be happy to answer questions in that setting also. And I will hand it back over to Dr. Maslick.
Perfect. Thank you, Jason. I would like to first open the talk with posing a question to you all. What is your biggest health and well-being concern for you student this year? Like many of us, have you been thinking about COVID? Or are you concerned about their mental health, their sexual health, maybe their chronic illness or injuries? Or perhaps you're aware that our squirrels are very friendly and some students like to feed them and you're worried about your student being bitten. Whatever your concern is, whether it's on this list or not, I want to reassure you that we here at UHS are well equipped to handle those concerns. This is the agenda of our talk. First off, we at UHS are at 207 Fletcher Street. If you are familiar with University of Michigan, we are on Central Campus, across from the Michigan League, right next to the dental school, and also close to 3 major bus stops. Now, when students are thinking about UHS, most of them are probably thinking about coming to us in case they're sick or maybe they've been injured. And it is true that UHS is very equipped to handle these downstream urgent concerns, and we have the resources to handle these. But we also recognize that we serve a very, very important role in actually doing upstream work to prevent illness and harm in the first place. And so we wanted to convey to you and to your students that we are also here in helping them to stay well and to maintain their health and their quality of life. We've also informed our work by looking at the data from the National College Health Assessment. This is an assessment that is done for students nationally every year. And the data from this research shows that there are some common major impediments to academic success. So stress, anxiety, depression, other mental health concerns, but also headaches, gynecologic concerns, and concussions form those top impediments to academic success. And while we in the maze are lower for the most part compared to the national averages in the blue, we recognize that we share these same concerns, and we have structured our resources to make sure we can address all of these concerns. We want to help our students thrive in whichever way they are hoping to thrive, both on a personal level and also on an educational level. And this campus model of well-being also recognizes that there are many, many aspects to a student's wellness, and we have thus kept all of those in mind as we've designed our programs. So let me talk about what we offer to our students. This shows you kind of the array of clinical services that we offer. We have a primary care clinic, which forms a lot of the work that we do, but also are very, very lucky to have the specialties that you can see here on this list. So gynecology and sexual health, psychiatry, eye care, dermatology, allergy clinic, a physical therapy department, optical shop for all of our eye care needs, a sports medicine clinic, a nutritionist, a team of social workers and care managers, a sleep medicine clinic, an eating and body image concerns clinic, and also a travel health clinic. We are incredibly lucky to have all of these resources and really are trying to be that one-stop shop for your students. Our staff are comprised of excellent physicians, advanced practice professionals, or nurse practitioners and physician assistants, nurses, social workers, medical assistants, optometrists, our dietitian and physical therapists. And we also have complex care teams where coordinated care is especially important. We have on our UHS website a list of all of the providers, as well as our pictures and some profiles. And we do encourage students to establish care with a clinician. So if you can have your student look on the website and establish with one of us, that would be highly encouraged. This is not all that we have. We are also incredibly lucky to have a lab, the radiology department, and also our own pharmacy in the building. For sure, it's important to mention COVID, as this has been a major focus for us this past year. We have designed our COVID work and really thinking about wraparound services. So preventing it by providing the COVID vaccine, which we do have the Moderna vaccine here, also providing the flu vaccine, coordinating with our campus surveillance testing program. Of course, we also manage patients, both in-person visits, we have telehealth visits, and we also were taking care of COVID concerns through the portal and phone calls. Our nursing team formed an incredibly important part of our strategy in addressing calls, and also a unique service that we have called MPOTA, which is a text messaging service that checks in with any patients diagnosed with COVID every day to screen for complications of illness. Mental health also deserves its own slide. This has been a major concern for our students. And as you can see from this diagram, we have designed it so there are many doors and there's no wrong door for students to access mental health needs. So wherever they need those clinical services, we are able to coordinate, whether it be with University of Michigan providers, community providers. We can help them in all of these ways. So how do you access our care? Because of COVID concerns, we do have visits by appointment only, and so please do have your student call. It would be probably helpful to have them have the phone number in their contacts list and on their cell phone, so that if they do have a need, they know how to quickly reach us. Just a note, we don't provide any dental care. We are not a hospital or equipped for overnight stays, and we do not take care of any prenatal services. For non-urgent health concerns, of course, students can just call and schedule an appointment directly, but for urgent health concerns, we often can connect them with a nurse. They may not need an appointment, but really are just looking to find out the dose of Tylenol or ibuprofen, or just reassurance, is this okay that I've been coughing for 3 days? Do I need to do anything else? We can help connect the students with the right services at the right time. Of course, in a medical emergency, please do have your students call 911. We are unable to provide emergency room services. And so for these types of concerns, we don't want to have any delays in them accessing the right care. We also have nursing advice available 24 hours and all 7 days of the week. So if they're just looking for advice, they can also call UHS for this. So what about costs? As part of their tuition, students have a health service fee, and this is what supports many of the services that we provide. So things that do not have extra charges are almost all of our clinic visits, including with our specialists, any of our nurse advice, our wellness coaching, and also their first evaluation with physical therapy. It covers a lot, but it doesn't cover everything. And so things that students do need insurance for would include medications, immunizations, any medical equipment, if they need lab work other than STI tests, ongoing physical therapy visits, anything outside of the building, outside of UHS would also need to be covered. And then radiology and lab will also be charged to insurance. Students can have access to a prepaid plan. So if they're not going to be here for the spring or summer programs for school, but they'll be in the area for other reasons, they can also have a prepaid plan that allows them to continue to access UHS between semesters. just again, a quick note, we are not the same thing as Michigan Medicine. So the Michigan Medicine hospital system is a fantastic partner. It is very close by to UHS. And while we collaborate, we are not the same thing. So any services done outside of the building and through university, so through Michigan Medicine, is charged to insurance. A quick note about confidentiality. So by law, all care for students 18 years and older, or for any emancipated minors, is confidential. And so students do have to sign a consent for any release of information or for us to discuss their care with parents or any other family members. So if you do want to be able to arrange for that, I've provided the hyperlink in these slides so that you can go to them and then sign the consent form. If your student will be a minor, so under 18, they also will need a consent to treatment form signed, and the hyperlink is provided here. If your student will be a minor when they start, you will have access to all of their medical information with the exception of anything related to sexual health, mental health, and substance abuse. Health promotion is one of the major items that we do. And so Wolverine Wellness is our health promotion arm of University Health Service. So they have amazing health educators who provide programs on a wide array of concerns. And as you saw from earlier on the National College Health Assessment data, where stress, relationships, sleep issues, loneliness are all major concerns, Wolverine Wellness is well equipped to help with all of these concerns. They also have a wonderful wellness dog named Hawkeye, who comes regularly to UHS and really has been a big mood booster for a lot of our students. So final things, take-home points. I would say these slides are probably some of the more important slides for you to take note of. So if your student has not been to the doctor recently and you just want to make sure that all of their preventive health is up to date before they come to UHS, then please do consider signing them up for a physical exam with their home doctor and just making sure that they are ready to go with any medications that might need to be refilled, contact lenses. If they need allergy shots, we can help coordinate with that. The prescriptions it's really great to come with a 3-month supply. That way students don't immediately run out of their medications. They can come in and at their leisure get settled in and then establish with a clinician here at UHS. Immunizations are an incredibly important part of keeping your students healthy. So vaccines of particular importance are the COVID vaccine, the flu shot, meningitis, HPV, measles, mumps, rubella, hepatitis, and also tetanus. If they do have any chronic medical problems and you think that they will need follow-up here at UHS, or maybe they'll need it, it would be really helpful in advance to have a summary letter of their medical conditions so that UHS can pick up from where their home doctor left off. We really are prepared and see our role as being their doctor, their primary care doctor at their home away from home. And so this will help us to do the same high quality care that your home doctor is providing. If they do need to establish with us, then scheduling that appointment in advance so that they can make sure that it's already on the books, because the schedules get very hectic once they start, then that would also be something to consider. We do suggest that you send your student with healthcare tools. And so there's a hyperlink here for some suggested medications and supplies. Things that I particularly think are helpful are a thermometer and also something to control pain as well as lower fever, so ibuprofen or acetaminophen. Since insurance is a really important aspect of making sure they're prepared, please make sure that your student has a copy of their insurance and prescription cards. Pictures are just fine, so if they can take a picture on their cell phone, then it'll be there for them when they need it. And also just make sure that your insurance, you know what the coverage is. Do they cover care here in Ann Arbor, or can you get an out-of-area waiver? If you do think that your insurance will not be adequate, I would highly consider our student health insurance plan. It is really a fantastic coverage. It works across the United States. and it cost about $2,000 a year. So a very, very well-priced insurance plan. If your student needs help with Medicaid, we also have staff who are able to assist with applications. Make sure your student understands insurance, just the basics. It's complicated for all of us. And so helping them understand will allow them to prepare for visits better. We also really encourage students to sign up for a patient portal account. It's something that takes just a few minutes, and it allows a lot of functionality, including students being able to self-schedule for COVID testing, sending messages to their provider, viewing any results of tests that were done, checking immunizations that we've administered. So it's a wonderful tool, and I would highly suggest that you have your students sign up for it. We wouldn't be a good clinical office without some forms. So here in the hyperlinks are a couple of the forms that we need you to provide. First, their immunizations record, and hopefully, ideally, at least 30 days before they arrive. Also, if they're going to be under 18, a consent to treatment form. If they've received their COVID vaccine, and once they've received the full series, uploading their COVID vaccine at the hyperlink that was provided. Wrapping up, here are some resources. I know this is a whirlwind talk, and so for mental health, we provided some links for our resources, and also just for stress reduction, we have a wonderful list of different ways that students can take care of themselves. If you have any health records questions, we provided a hyperlink. And then if there are other questions that we have not answered or are specific to your situation, you can always call us at this number listed, as well as email at contactuhs@umich.edu. Thank you so much for your time. I'm going to stop my share screen and allow for any live questions that would come in, or also if any more questions that you would like to post on the Q&A.
Since there's no questions so far, I am going to give some answers to some common questions that people typically have for me. And one of the main ones is, are there required immunizations at the University of Michigan? And the only immunization that might be required for an undergraduate is the COVID-19 vaccine if you're going to be living within the University of Michigan dorms. Apart from that, there are no required vaccines, but we highly recommend that your student come up to date on their vaccines, including their tetanus boosters, their measles, mumps, rubella, and their meningitis vaccines.
There are additional questions coming in right now. So the first question I'm seeing here is, what if our child already has signed documents to give us access medically? So we do need to have our forms signed, but absolutely, if we have those forms, then we'll be able to coordinate so that you will have access, and that will be filed in our record. The next question is, do you provide urgent care like stitches, broken bones, earaches? So anything that you would think of for a primary care clinic, so your home doctor, we provide, and all of the things you listed here. We know that urgent care is one of the major concerns for our students, and so we can take care of sutures, we can diagnose fractures, we can manage basic fractures. If they need surgery, then we can always refer them on. But any of those concerns that you would go to your normal home doctor, we can take care of. So as far as the question, is there anyone at University of Michigan we can contact for help understanding our insurance situation? So if I can ask Janet to provide the information for managed care, that would be the place that would be able to answer insurance questions. Our billing office, depending on what your questions is, would be the other place to go. So have there been any cases of meningitis B? We have not had any cases of meningitis B here at University of Michigan. The next question is, do you have this PowerPoint file online and the link? And that the files will be posted soon, and that will be sent out to everyone. Oh, and actually Janet's posting on here, the video and slides with links will be posted within a week. Thank you, Janet. The next question, if we have a power of attorney document from our child, do you need a copy? Power of attorney documents would be very helpful to have, yes. How far is University of Michigan Hospital? It's about a 10-minute walk from UHS. If the students need transportation, we provide the transportation from UHS to the hospital. As far as providing the POA documents, on the slides are the email for, sorry, the hyperlink for records, and you can go to that link and it'll lead you to the phone number as well as different ways to submit forms. Does your, Jason's answering about evening and weekend hours, so I'll leave that to you, Jason. And does the university have power of attorney templates? So legal is another service that we have here at University of Michigan. So I don't know, Jason, do you know if we have specific templates for that? We have durable power of attorney. We have a link that we give to patients that they can look at.
If you're looking for the ability for the physicians to communicate with you, then you can sign, or you and your student can sign the release of medical information that allows us to talk with you. If by durable power attorney, there's specifics there that allow you to dictate the care of that the student receives and be more actively involved with it. We do not have templates for that, and we encourage you to send those to our medical records department, and that address can be found on our webpage.
Thanks, Jason. There's a question for students with chronic health conditions. How soon should a student have their first appointment? So it depends on the severity of the chronic health condition. If it's something routine that normally is not something that is actively being managed, but just needs routine follow-up, maybe every 6 months or so, then that's really at the student's convenience. It's nice to have these things set up in advance, though, because we know that often they get caught up in all of the wonderful things here at the university, and then they forget until they're running out of medications or their conditions are flaring. So it's not an urgent concern to get in immediately, but more about how quickly you think it's important for them to have an established physician who can manage their concerns or be ready. So if it's something that does flare more frequently, then I would do the appointment sooner rather than later.
There have been some questions about insurance in University Health Service and immunizations in insurance. So if your student is seeing a physician at the University Health Service, we do not bill your insurance for that. Visits with the providers are covered just by them being a student and paying the health service fee. Where insurance comes into play is if they need outside services, such as an MRI, or if we were to prescribe medication and they go to a pharmacy to get that medicine, or blood work. Those are services that would get billed to insurances. So when your student sees a provider or a physician, the insurance won't be billed for that. But if they've got concerns that their insurance won't cover blood work or radiology services, we can refer them to a facility where your insurance will cover that if UHS is not one of those. Immunizations are either an out-of-pocket cost to your student or billed to your private insurance. That includes the flu shot. The only exception to this right now is the COVID-19 vaccine. There is no out-of-pocket cost for that vaccine, though we are able to bill the insurance for an administration fee. But if your insurance does not cover that administration fee for the COVID-19 vaccine, there's no out-of-pocket cost for that. Our UHS pharmacy is able to fill prescriptions from any physician. Your physician just needs to send the prescription either to the UHS pharmacy electronically, or your student can bring paper copies of their prescriptions to the UHS pharmacy, and they'd be happy to fill those for your student.
I would just add that our pharmacy also can be called, and if they are provided the information, and so say you want to transfer the medication from a pharmacy near you to our pharmacy, if you provide that information, our pharmacy will take care of transferring the prescription here to UHS. There's a question about eosinophilic esophagitis and whether or not we have services for this. So depending on the severity, most likely they'll need a gastroenterologist, and we have superb GI specialists at Michigan Medicine. There's certainly a lot of overlap with the care that we provide as primary care physicians. So it's something that we could definitely serve as the PCP to help coordinate that care. As far as students getting in for an office visit, we are structured to take care of urgent care needs for a majority of our patients. So we have same day appointments every single day. And, even for more routine needs, our access is also very good. So the question is, public insurance such as Blue Cross Blue Shield an acceptable form of insurance for the student that is under a family plan? So there is a list on our website of all of the insurance plans that we accept, and Blue Cross Blue Shield, as long as they are covering in Ann Arbor and for services here, is excellent insurance. Jason, is there anything you would add about that?
So Blue Cross Blue Shield is nationwide, and some of the Blue Cross Blue Shield programs are actually HMOs and limit care to a specific geographic region. So while we do take some Blue Cross and Blue Shield insurances as to a specific insurance plan, we would encourage you to take a look at our website and see if your specific plan is listed. If it's not, our business office is the place to call to ask about your specific insurance plan, because the variability in Blue Cross Blue Shields are so vast that I would hate to comment on any specific plan without knowing that specific plan's details and explanation of benefits.
Thank you. There's a question, is there a limit to how many visits or services a student can get for free or for a subsidized cost? There's no limit to the number of primary care. Well, there's no limit to visits. As far as the cost goes, as long as it's a clinic that doesn't have any charges. So for the clinician visits, primary care, the specialty clinics, really it's only physical therapy that after the first visit, those are all have a cost, but any of the clinician visits there's no cap on that. So I think we have time maybe for one more question, but thank you so much for all of these great questions. Hopefully they've been helpful for the whole group in making sure that you are prepared with all the answers about UHS. Is UHS or CAPS better for mental health things? So thank you, great question. So CAPS is is mainly for therapy. They do have a few psychiatrists, but mainly we are thinking about CAPS if you're thinking about therapy needs. University Health Service is for the medical visit. So if your student needs either medical management, or if they're not sure what to do, there's no wrong door. We're happy to advise and listen to their story and then determine what resources would best meet those needs. So as far as the Q&A, there are a lot of links here, so feel free to just peruse quickly through before we end this session, in case there are any links that you would find helpful to look at later. Thank you all for your time, for your questions, for your interest in supporting your student. Please let us know if you need anything. Please feel free to contact us through the contact information on the slides, and have a great weekend.